I am with Dr. Isaiah Redfern here at Ottawa Performance Care, and so I figured we basically talk about what your title is and what exactly do you do.
Yeah. So I was formally trained as a chiropractor, but then during my time at school, I wasn't able to help people in a fast enough speed, and I wasn't able to help a lot of the cases that I had most interest in. So I primarily treat concussions, migraines, those types of things. And in order to really have a seat at the table, I needed to really up my game in neuroscience. So I've specialized in clinical neuroscience. That's the way I approach every case, whether it's pain like back pain or a tear in the shoulder, or it's a case like yours, a concussion case. At the end of the day, the one thing that's the same is the nervous system is always in charge.
Right. Okay. That's a good explanation. Okay.
Helps.
Yes, you know what you're talking about. Okay. What is one thing you remember when I first came in to see you?
About like your symptoms,
Yeah,
just about
just
you.
both.
hmm
I'll say.
One, I liked you were bold still. Like you didn't let your symptoms really define you, and you still like showed up, right? You know what I mean? A lot of times I have patients or I just see people out there who just really identify and let their conditions label them. And I really liked when we first met that you came out confidently, hi, I'm, right? And we started right then and there. Symptom wise, I guess the thing that stood out was the tremor and I guess the facial spasm, right? That would just come out of nowhere.
Yeah.
I never got to really see the outbursts or the mimicking.
Yeah, because at that point it was already gone.
Right?
Yeah.
So that was something that I didn't really get to really see.
That's true. Never mind. It wasn't already gone.
Yeah,
It
no,
was.
no,
It
it
just
wasn't.
wasn't present.
It was just like a good day for you.
Yeah, because there was
Yeah.
no outside noise really. But if there had been, you would have seen it, 100%. So in my case, in terms of treatment plan, like what did we do for me?
The biggest thing for you was cutting inflammation down.
Okay.
Right? As soon as we did that through food, when we just cut out carbs, we had a drastic change. Right? Then when we went and targeted inflammation specifically through antioxidants, right? We again caught a big amount of change. It was such a big amount that those 2 weeks before we started therapy and we just did lifestyle changes, we already had 50% change. Then when you were here, our treatment to get that last half was really working with the vestibular system, the cerebellum, right, which is in charge of coordination, because everything we were working against for your case was coordination, right?
Yeah.
We had the shake in the hand, that's uncoordinated movement. We had the facial contortion, right? That's uncoordinated muscle tone, right?
Yeah.
All of our things for you was just coordination.
Okay.
Does that make sense?
Yes, it does.
Okay.
Yes, it does. And I still find it interesting. Side note that like the leg thing didn't really show up this week at all. Really, like barely.
Yeah. So that leg thing showed up like what it looks like in a stroke case, right? Where you just lose function and you drag it.
Yeah.
But that again is just due to poor management of fuel, because there was never a vascular issue. We never had a lesion or a tumor, any of those things.
Yeah.
Ours was just, for some reason, once we deplete that pool of fuel, we now have patterns that look like a stroke, which is just loss of function, right? So again, everything was just like a big red glowing sign saying fuel, 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 and that's what your case was.
Okay, so what other symptoms do you treat other than concussions and symptoms for the viewers out there that so you said vestibular issues?
Yeah, so the vestibular issues, difficulties with movement, either too much movement, right? Like if an arm like flings up and you don't control that. Slowness of movement, like if you are trying to move and it's taking a really long time to get there. really, it's just it's really hard to give that as a definitive answer. But
no problem.
what I say to people is that my consults are free. It just gives us an opportunity to talk just about the case.
Right.
And if the case sounds like a good fit, then we can arrange an appointment.
Yes.
Right. But just to have a consult and just to talk about the case, that's half an hour, and that's free of charge.
Perfect. Yeah. That was helpful when we talked, because then I felt like I was able to zero in on what exactly was actually happening on my day in a day-to-day basis, and rather than just showing up and then getting to talk then, which would have taken more time.
Oh yeah.
Right? Because I can talk. So, yeah. I have a question here. Like, what do you believe about FND? I know you don't like the word or the terminology.
Yeah, I don't like the term FND because it sounds like there is a lifelong disabling kind of injury.
And that's what we're led to believe in the medical community, I would say. We are led to believe that.
FND, what happens in FND is usually the symptoms that match a concussion, right? When there's a concussion, areas of anatomy that used to talk just fine, right, don't talk as well anymore, and now there's symptoms, right? It could be motion sickness, difficulty with cognitive tasks, those types of things, right? But now, in cases where it's given FND as the name, most times there hasn't been a concussion. There's a separate insulting injury, but it presents still the same. It's just anatomy that used to talk, that for some reason it's not talking anymore. But if you just give those areas of anatomy exercises and you do them at the same time, now those areas of anatomy talk again, and the symptoms, like in your case, just fall away. And you don't have them anymore.
Yeah, which is just like, because the majority of us, either people go into remission but then it comes back, but then it's like, how do you even go into remission if it's not treated? It's possible. It's just it will always keep coming back to some degree or get worse. Like in my case, it was getting worse.
Yeah, the way that so the reason why it could go into remission and then come back is our nervous system does a really good job at compensating. So we'll figure out another way to get that job done. But that compensation can only last for a certain period of time because it's not as effective as the original way. Right? So we have a symptom, we compensate, it gets better. The compensation fails after a couple weeks or months or years, and now the symptoms come right back. Or we have the case where things get worse, right? And that's just because this anatomy, it's continuing to not talk. Or think of it like this. Anatomy used to talk perfectly. Now it stopped talking just a bit, we have symptoms. It continues to stop talking, symptoms get worse and worse and worse until they don't talk, period. Right?
Yeah.
But through therapy, you just make them talk again, and things are okay. Right? And now there's no more symptom. So I'm much more a fan of reintroducing anatomy as opposed to giving someone a compensation to try to mask it, because those will come back.
Yeah.
Right.
Like I remember I used to walk backwards as a way to walk sometimes if it was really bad. But I don't have to do that anymore because I can walk forward just fine without anything happening.
And a sled pull. You can
I can
a
do
sled
that.
pull.
First time in my life, guys. So, what can you treat from Ramsay-Hunt syndrome? Because I know my case kind of involved the two of them kind of overlapping.
So, I mean, a case study of one doesn't really give me enough evidence.
I understand
right?
that, yes.
But
that's true.
For your case, you don't have the sensitivity to sound anymore, right?
No, which is crazy.
We
which
just
is
had
amazing.
you in the gym when I had you standing beside a speaker and I cranked it up to 10. So that's awesome. The balance issues that come with it.
Yes.
The facial symptoms that come with it, right? And the nerve pain, right?
Yes.
Those four things are kind of the most commons that come up with that. And in your case, they responded perfectly, right? I can't say that that would happen in every case,
Mm-hmm.
but I mean, a case study of one, right? Right. So the way I look at it is that those are symptoms that maybe I can't directly treat, or if someone can't come here to Ottawa, but those symptoms, period, can go away.
Yeah, which is something I think we don't think of in the RHS community too.
Mm-hmm.
I think we think we're stuck with this stuff with a lot of what we experience.
If you're sensitive to light, sounds, those kind of things, that always points to inflammation. That's just robbing fuel that doesn't allow us to inhibit those small things like a car horn, right? That most people hear that and it's like, okay, that's kind of annoying. But someone who's sensitive to it due to inflammation, that causes a startle reaction, right? Or a verbal outburst, those types of things.
Yeah, which was me. So
yeah. It was.
Exactly, it was. So touch on this briefly. Will FND ever return to the way it was in my brain?
No.
Awesome.
So there's this concept,
Yeah.
which is what plastic change in the brain is based off of, called Hebbian learning. And all that means is that if you want two areas of the nervous system to talk and fire as one, if you just activate them at the same time, right, they'll wire back and forth and they'll make a bond kind of thing.
Yeah.
Right? This obviously isn't like how it's phrased in anatomy. This is just for here.
This is just, yes.
But essentially areas that fire at the same time will make a wiring back and forth. And then once you have that, those roads are always established.
Yeah.
And they don't just get potholes for no reason.
Right. Yeah.
Once the road is there, the road's there.
The road's there. And so I think this type of treatment is the road to, I'm using an analogy, is the road to retraining my brain to be what it was before.
Absolutely.
Because we've always been told with FND, you got to retrain your brain, but there's been no answer as to how in the world to do that.
Yeah.
And this is the way to actually do that.
Yeah. So the great thing is that I'm not the only one, which is the best part.
Yes.
So as we spoke about earlier, I'm a member of this organization called IAFNR, which is just the International Association of Functional Neurology and Rehab. And it's beautiful that the title is in the right.
Yeah.
It is like the name is in the title, right?
Yeah.
We all specialize, and this is a worldwide organization, functional neurology and rehab. So people in this organization are perfect for cases where it's FND.
Yeah, it's great. So I have footage of a little bit of what we did.
Yeah.
And it may look, I don't want to say silly, but it looks maybe more simplistic than what we would expect, and what the average person or even me would expect in terms of treatment.
Yeah, super simple stuff, like a hot pack on your stomach, keeping your eyes on a dot, and I moved your head in specific ways, doing a mirror where you would just copy everything I was doing, flashing.
And that would help with my tremor.
Yeah, right. Yeah. Flashing light into your eye.
Yeah.
Right. Playing certain frequencies of sound.
Yes.
Right. Asking you to stand with your feet together. But the thing with it is that it's repetition. Right? You have to think of every treatment as a dose. Right?
Yes.
And you need to just keep hammering that dose.
Mm-hmm.
But yeah, a lot of the treatment looks simple, but there are clinics all over the world that are much more high tech, and they have pieces of equipment that get the job done even faster, right? Where they have things like you sit in this chair and it can spin you forward, sideways, off axis. It's called the Mark. It's incredible. It like that tool is amazing, but they only have that in Florida.
Yeah, is that at Plasticity Brain Centers?
Yeah.
Yeah. Because I checked that out.
Yeah, it's they're amazing at what they do over there.
So in terms of treatment, I've been here for the last 5 days. Yeah. 6 if you count the consultation and the little exam. The little exam and the kind of first treatment exam. Kind of thing. So 6 days. Yeah. In 6 days, by even just the third or fourth day, I was able to not have to wear noise cancelling headphones in restaurants or in a gym, which is literally right beside us.
Yeah.
Yeah, which is, so I have to get used to being normal or in normal settings.
Yeah.
But being myself and kind of
Mhm.
managing all that. So that's going to be
The biggest thing right now for your case is just because you were fighting against FND and all those symptoms for 2 years, is that although you're symptom free right now, we have to reintegrate back into society,
yes.
right? And expose ourselves to those environments that were problematic, loud places, busy places, right? And as well, just kind of like do it gradually, just until both you expose yourself and you prove back towards yourself that, I am good, right? Because it's been 2 years of your life being changed. It's totally different, right?
Yeah, that's true. And that's what I'm going to be doing. Last question is, what would you tell someone who's watching right now and they don't know what to do with their symptoms? They might be experiencing some of what I'm experiencing. They might be experiencing non-epileptic seizures, whereas I wasn't. That wasn't a part of my case, but stuff like that.
I would say that don't take anything you heard here as medical advice. First,
Yes.
I can't give you anything specific for your case without doing an exam.
Right.
But if you're not near Ottawa, or even if you are, it doesn't mean you have to come see me. There's a lot of me's out there, so that's our nice thing. I think you're gonna send a link to where they can get.
It'll be in the description box.
Awesome. So in the description box, there'll be this link, and it'll show you a list of doctors all around the world who do the same things as me, who treat the same types of cases, and who can really make a change in your case. So don't feel like if you're on the other end of the world or in the States or anything like that, that you're too far away and there's no hope. There's always hope. There's doctors like us all over the world, and they can absolutely make a huge change in your case.
Awesome. Great.
Cool.
Okay.
Awesome, guys.
Thank you so much. Yeah.
Sweet.
It's great.
Awesome.
Okay.
Cool.
Good time.
Perfect. This is good.
Yes.
It is good.
I'm excited.
It's a good interview. It's like you've
Yeah?
been doing interviews all your life.
Awesome.
Listen.
This was the
I
first
just
one.
have to come back and just
Yeah.
do more interviews.
More interviews, and then I'll get there.
Oh, you're already there. Come on.
Get there with the